This is eNCA. Now, the Health Ombudsman Malegapuru Makgoba says the Constitution may be failing the healthcare sector. Makgoba says it stops the Health Minister from intervening during crises like the Life Esidimeni tragedy.
The Constitution also created this situation where it disproportionately awarded the power of health in the province against the national minister. So people kept on saying, where was Dr. Motsoaledi? Dr. Motsoaledi could not be anywhere because the Constitution did not allow him. And when you looked at the National Health Act and look at the previous act of the apartheid era where the national minister had the power, those powers had been taken away in the new dispensation given to the provinces. And that's why in one of my questions to the MEC was, why was the minister not informed? And she was pointed to me and said, well, I did not need to inform him. This falls within my sphere of governance. And she was right, because that's what's in the Constitution. So one of my recommendations was that really the Constitution and the National Health Act should be re-looked at and give more powers to the national minister to prevent incidences such as this from happening.
All right, so as Professor Makgoba was saying, South Africa's constitution then is causing a further decline in the healthcare sector. And as we've just reported, referring specifically to the Life Esidimeni tragedy as an example. Our reporter Aldrin Sampear has been following that discourse and joins us now to discuss it in a little more detail. Aldrin, good afternoon to you in Johannesburg. So in what way then is the constitution failing the healthcare sector? What else did the professor have to say in that respect?
Well, basically this depends on at which point does the minister intervene when the Department of Health is facing a crisis.
Please bear with us today.
The minister's argument has been that he's only allowed to
a temporary studio
at a later
in
stage
Stanton,
when
north
it's quite
of the
late
city,
for him to intervene. He wants powers that will allow him to intervene at an earlier age. Just looking at a few other reports and where the minister was speaking at his budget vote as well, where he says that his department needs more powers in terms of trying to also be, or rather be consulted when it comes to the appointment of these MECs, the provincial health MECs, because as it stands at the moment, it is the prerogative of the Premier who is in the province, and the Premier then decides who he appoints to become the MEC of health or the MEC of any other department in the province. And this is an issue that the Ombudsman has also been raising, is that if you look at the prerequisites as it stands at the moment when appointing an MEC, there is nothing that states that that person must have some sort of background in medicine. And this is why the Department of Health has been arguing, and the Minister has been arguing, that he needs to be consulted when it comes to the appointment of the MECs of health as well.